Today's podcast is titled 10 KPIs that define a thriving and profitable dental practice. Before we get into this topic, I have a quick announcement to make. We have a masterclass coming up, thrivingdentist.com/masterclass. It's on 16th of July, 2024, 8 to 10 p.m. Eastern. So you get 2 hours of CE. And the topic is creating a relationship-driven practice. Gary, any comments?
I'm excited about this masterclass. It's brand new. We've never done this. I'm knee deep in creating all the content for that masterclass and really enjoying it. And I can assure you that you're going to get a lot out of that masterclass. Obviously, if you are a listener of the Less Insurance Dependence podcast, you're interested in successfully reducing your insurance dependence. And one of the keys, perhaps the most important key, is developing a relationship-driven practice. And there's so many different nuances that you can apply in your practice to become more relationship-driven. Well, come join us. 2 hours, Tuesday evening, July 16th, starts at 5 p.m. Pacific time, 8 p.m. Eastern time. Very inexpensive, less than $100. You'll get 2 hours of CE. And come join us. You can register at thrivingdentist.com/masterclass. Look forward to seeing you there.
Thank you, Gary. We have a lot to go through, so let's jump in with the 10 KPIs.
Yeah, so KPIs is an acronym for Key Performance Indicator. And in our coaching work, we have defined 10 KPIs for each and every one of our clients. Now, the actual goals are indexed and customized for each client. But I want to go through those 10 KPIs, and I want to encourage you to take a look at your practice through this lens, because this is like a dashboard. This is a way for you, if you measure these monthly, this is a way for you to take the pulse of your practice. Naren, it's kind of like the physician that grabs the stethoscope and puts it on your chest to listen to your heart. And that's what these KPIs do. They allow you to take the heartbeat of your practice and see how you're doing. So let me go through them. I'll number them 1 through 10. Number 1, new Google reviews. The goal that we set for our clients is to have at least 10 new Google reviews each month. Now, if we have clients that are getting more than that when we start, we index it to their to be a little bit more. Any goal I'd like it to be a stretch, but not so much that it's not realistic. If you've never measured your Google reviews, then a good place to start is 10 new Google reviews a month. Number 2, we measure new patients per month. And what we define as a new patient, by the way, is an adult who goes through a comprehensive exam. An adult that goes through a comprehensive exam. If you see children, wonderful. However, they don't count as new patients. And also, if you see emergency patients, wonderful. We love seeing emergencies, but they don't count as a new patient until they come through as a comprehensive exam. And I can't give you a generic number because it'll vary widely depending on your practice. Are you a 1-doctor practice? Are you a 2-doctor practice? What is your appetite for new patients? But it's important to get that number right, because that number will allow you to achieve, your production goals as you're hitting the right number of new patients every month. Number 3, we measure your collections every month. Of all the different numbers we can measure, collections are very important because it's real money that you can deposit in the bank. So we look at your collections every month as KPI number 3. Number 4, we now break down production, and we start by number 4 as total office production. That would be everything that happens in your office. Doctor production, hygiene production. If you have a specialist that comes in, maybe you have an oral surgeon that comes in a couple days a month, all that counts as total office production. Number 5, we then break it down to doctor production. So we exclude hygiene. So we look at doctor production individually. And we pull that out so we can look and make sure that doctors are carrying their appropriate weight in the practice in terms of the production.